Hello, I'm Dr. Carrie Jones. Today, we'll discuss something critical: how to recognize the early warning signs of liver failure. Your liver plays an incredibly important role in your health, processing everything you eat, drink, and breathe, and it helps in over 500 essential bodily functions. When your liver starts to fail, it can lead to serious complications. In fact, liver failure can be life-threatening if not detected and treated early. In this video, we'll explore 16 critical warning signs that your liver might be failing, and I'll guide you on how to recognize them. Early detection is key, as it can provide an opportunity for timely medical intervention. Some of these symptoms might seem mild at first, but don't ignore them, as they can worsen over time. By paying attention to these signs, you can take action before it's too late. So let's dive in. Hello, I'm Dr. Carrie Jones. Today, we'll discuss something critical: how to recognize the early warning signs of liver failure. Your liver plays an incredibly important role in your health, processing everything you eat, drink, and breathe, and it helps in over 500 essential bodily functions. When your liver starts to fail, it can lead to serious complications. In fact, liver failure can be life-threatening if not detected and treated early. In this video, we'll explore 16 critical warning signs that your liver might be failing, and I'll guide you on how to recognize them. Early detection is key, as it can provide an opportunity for timely medical intervention. Some of these symptoms might seem mild at first, but don't ignore them, as they can worsen over time. By paying attention to these signs, you can take action before it's too late. So, let's dive in. Part 1. 3 early signs of liver failure. Severe fatigue and weakness. One of the first signs that something might be wrong with your liver is extreme fatigue and weakness. No matter how much you rest, you feel drained and have trouble doing everyday tasks. The liver is responsible for energy metabolism, and when it's not functioning properly, your body struggles to convert nutrients into energy. This can make you feel constantly tired, and the buildup of toxins in your bloodstream can add to this sense of exhaustion. If you're experiencing fatigue that's unrelieved by rest, it's crucial to pay attention to other symptoms and consult with a healthcare professional. Loss of appetite and nausea. A significant reduction in appetite, frequent nausea, and unintended weight loss can also be early indicators of liver failure. The liver is vital in processing nutrients, and when it begins to fail, it can't effectively process what you eat, leading to a lack of hunger. As toxins build up, this can cause nausea and discomfort in the stomach. Additionally, the liver might enlarge, pressing on your stomach and making you feel full even when you haven't eaten much. If you notice a persistent lack of appetite and nausea, consider consulting your doctor for further evaluation. Abdominal and shoulder pain, especially in the right side of the abdomen, below the rib cage, can be a warning sign of liver problems. While the liver itself doesn't have pain receptors, the tissues around it can be affected by inflammation, leading to pain. This discomfort might also radiate to the right shoulder and neck. People with liver cirrhosis or liver failure often report this dull, nagging pain. If the pain intensifies, it's crucial to seek medical help, as it could indicate that the liver's condition is worsening. Part 2. 13 later warning signs of liver failure. If liver failure progresses without intervention, more severe symptoms can appear. These are critical signs that your liver is in serious trouble, and it's important to act quickly by seeking medical help. Ignoring these signs could lead to irreversible damage, and in some cases, the need for a liver transplant. Here are the later warning signs of liver failure. Yellowish skin and eyes, jaundice. One of the most recognizable signs of liver dysfunction is jaundice, which causes a yellowish tint to the skin and the whites of the eyes. This occurs because of a buildup of bilirubin, a substance that the liver normally processes and excretes. When the liver isn't working properly, bilirubin accumulates in the bloodstream and causes this yellowing. If you notice this symptom, it's important to get a bilirubin test to confirm whether liver failure is the cause. Dark urine and pale stools. When the liver is failing, bilirubin doesn't get processed as it should, which can lead to changes in urine and stool color. Your urine may darken and take on a tea or cola-like appearance, indicating too much bilirubin in the system. Meanwhile, your stools may become pale or clay-colored due to a lack of bile in your digestive system. If you notice both of these changes, it's a sign that your liver may not be functioning properly and that immediate medical attention is needed. Confusion and mental changes. Hepatic encephalopathy. Your liver plays a crucial role in filtering toxins from your bloodstream. When it begins to fail, those toxins can accumulate and affect brain function. This condition, known as hepatic encephalopathy, can cause confusion, changes in personality, irritability, and difficulty concentrating. As the condition worsens, individuals may become increasingly lethargic or disoriented. If you notice cognitive changes or confusion, it's important to seek medical attention right away to prevent further damage. Foul breath, fetor hepaticus. Another symptom associated with liver failure is a distinct foul breath. This odor, often described as musty or similar to rotten eggs and garlic, is caused by the buildup of ammonia and other odorous compounds in the body. Normally, your liver converts ammonia into a substance called urea, but when it's not functioning properly, ammonia levels rise, and the body excretes it through the breath. If you notice this unusual odor, it may be a sign of liver dysfunction and requires medical attention. Muscle loss and twitching. As liver failure progresses, muscle loss becomes common, particularly in those with cirrhosis. The body begins using muscle tissue for energy because it can no longer properly process nutrients. Additionally, high ammonia levels can contribute to muscle weakness and twitching. In severe cases, liver failure can cause involuntary muscle jerks or twitches, a condition called myoclonus. If you experience muscle loss or twitching, it may be time to consult with your doctor for a proper diagnosis. Itchy skin, pruritus. Persistent itching, particularly on the palms of the hands and soles of the feet, is a common symptom of liver failure. The liver's inability to process bile properly leads to a buildup of bile salts in the bloodstream, which then gets deposited in the skin, causing intense itching. This itching is often worse in the evenings and can be triggered by factors like heat or certain fabrics. While skin hydration may provide temporary relief, it's essential to seek medical treatment for the underlying liver issue. Fluid retention and swelling edema. When the liver begins to fail, it can cause fluid buildup in the body, particularly in the abdomen and legs. This swelling, known as edema, occurs when the liver can no longer produce enough albumin, a protein that helps maintain fluid balance in the bloodstream. Without adequate albumin, fluid leaks out of the blood vessels and into surrounding tissues, causing swelling. If you notice a bloated or swollen abdomen or swelling in your legs and ankles, it's time to get a liver function test. Part 3. More warning signs of liver failure. As liver failure progresses, additional symptoms may appear that indicate the condition is worsening. These signs should not be ignored, as timely medical intervention can help prevent further complications. Here are more critical symptoms to watch for. Easy bruising and bleeding. When the liver is not functioning properly, it cannot produce the clotting factors necessary to stop bleeding. This leads to an increased tendency to bruise easily, even from minor bumps or injuries. You may also experience prolonged bleeding from cuts, as the liver is unable to produce enough clotting proteins. If you notice frequent bruising or unusual bleeding, it's essential to consult with a healthcare provider, as this could indicate severe liver dysfunction. Vomiting blood. Another alarming sign of liver failure is vomiting blood. This can occur due to portal hypertension, which is a condition where increased pressure in the veins that supply the liver leads to swollen blood vessels, called varices. These varices are fragile and can rupture, causing bleeding in the esophagus or stomach. If you vomit blood or notice a coffee ground-like substance, it's crucial to seek immediate medical attention, as this is a medical emergency. Shortness of breath in advanced liver failure, especially in cases involving portal hypertension, fluid buildup can affect the lungs, making it harder to breathe. Shortness of breath may occur, particularly in individuals with cirrhosis, as the fluid in the abdomen can press on the diaphragm, restricting the movement of the lungs. This symptom is often a sign that liver failure has reached a critical stage, and it requires prompt evaluation by a doctor. Low urine output. One of the severe complications of liver failure is kidney dysfunction, known as hepatorenal syndrome. As the liver fails, it can affect blood flow to the kidneys, leading to a decrease in urine output. If you notice that you are urinating much less than usual, or if you are not urinating at all, it could indicate kidney involvement in liver failure. This requires immediate medical intervention to prevent further damage to both the liver and kidneys. Spider vein spiderangiomas, or small spider-like blood vessels, can appear on the skin, especially in the face, neck, arms, and chest. These veins are often a sign of hormonal imbalance caused by liver failure. In liver disease, the liver is unable to metabolize hormones properly, leading to an increase in estrogen levels. This imbalance causes the blood vessels to widen and form spider-like patterns on the skin. While not always dangerous, this symptom can indicate a more serious underlying issue and should be assessed by a healthcare provider. Poor vision liver failure can also affect your vision. Vitamin A is essential for maintaining good eye health, and the liver plays a key role in storing and processing this vitamin. When the liver is not functioning properly, vitamin A deficiency can occur, leading to night blindness and other vision problems. In severe cases, a deficiency in vitamin A can result in a condition called xerophthalmia, which can lead to permanent blindness if left untreated. If you notice any changes in your vision, it's important to see a doctor for a thorough evaluation. Part 4. When to seek urgent medical help. Recognizing the warning signs of liver failure early is crucial for improving your chances of recovery. If you experience any of the symptoms we've discussed, especially in combination, it's essential to seek medical help immediately. Some liver issues develop quickly, leading to acute liver failure, which requires urgent treatment. On the other hand, chronic liver failure progresses more slowly, often over months or even years, but it can still become life-threatening if not properly managed. If you suddenly notice any of these symptoms, particularly jaundice, yellowing of the skin or eyes, abdominal swelling, confusion, or severe fatigue, it could indicate that your liver is failing. This is especially urgent if these symptoms appear in combination, such as with nausea, vomiting blood, or difficulty breathing. What to do? Visit a healthcare provider immediately. If you notice symptoms of liver failure, contact your doctor or visit an urgent care facility right away. They will perform tests to determine whether liver failure is present and how severe it is. Emergency room. If you experience life-threatening symptoms such as vomiting blood, severe confusion, or shortness of breath, go to the emergency room immediately. Liver failure is a medical emergency that requires immediate intervention. Liver transplant consideration. If liver failure progresses to a point where a liver transplant is needed, the doctor will discuss your options. This can be a difficult process, as organ transplants involve a long waiting period and many complications. Early detection can help you avoid reaching this stage and may improve your overall prognosis. Preventing liver failure. While some causes of liver failure cannot be avoided, maintaining a healthy lifestyle can significantly reduce your risk. Here are a few tips to help you protect your liver. Maintain a healthy diet. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Avoid foods high in sugar, salt, and unhealthy fats that can put extra strain on your liver. Exercise regularly. Staying physically active helps maintain a healthy weight, which reduces the risk of fatty liver disease. Avoid alcohol and toxins. Excessive alcohol consumption is one of the leading causes of liver damage. Avoid drinking alcohol in large quantities, and be cautious of environmental toxins or substances that can harm your liver. Get vaccinated. Vaccines for hepatitis A, B, and C can protect you from these viral infections that can damage the liver. Monitor your medications. Some medications, both prescription and over-the-counter, can put stress on your liver. Always follow your doctor's advice regarding medication use and avoid self-medicating. Your liver is an essential organ, and recognizing the early warning signs of liver failure is key to preventing serious complications. If you notice any of the symptoms we've discussed, don't hesitate to seek medical attention. Early intervention can make a world of difference, so stay proactive about your liver health. Thank you for joining me today. If you found this information helpful, don't forget to like this video and share it with others who may benefit from learning about liver health. Make sure to subscribe and turn on notifications so you never miss an important update. Take care of your health, and I look forward to seeing you in the next video.